My name's Nigel Jones. I was the first Professor of Neurosurgery in Adelaide, funded by the NRF.
What first piqued your interest in medicine?
I'm not really sure. I came from a background where none of my relatives were doctors, so I didn't really have much of an idea what being a doctor was all about. I think probably at school, teachers suggested that it would be a good career, and I eventually became very interested in doing it before I started. I think these days I might have done something like computing and IT, but that wasn't around in the time when I was looking at what I was going to do at university.
What made you decide to pursue a career in neurosurgery?
I decided fairly early on, while I was still a medical student, that that's what I wanted to do. I enjoyed both medicine and surgery, and I found neuroanatomy fascinating, and I thought that neurosurgery was a good mixture of both medicine and surgery.
How many years did it take to train to become a neurosurgeon?
Well, it's 6 years as an undergraduate to do medicine, then an intern year, 2 years of basic training, 4 years of advanced training, and then I did 3 years overseas to do research training.
And did you have any standout teachers or mentors along the way?
I had a lot of standout teachers and mentors. In medical school, my pathology tutor, Ted Cleary, was a standout teacher for me. He made it very interesting. To him, medicine was like solving puzzles, and I really enjoyed that. It gave me a really good outlook on learning with the basics of pathology and trying to work out complex puzzles. Later, in my final year we had to do an elective, and I did that with Paul Carney, one of the senior neurosurgeons here, and thoroughly enjoyed it, and decided then that I was definitely going to do neurosurgery.
You mentioned that you had the opportunity to train overseas. What was that experience like?
It was fantastic. I was lucky to go to Oxford. I was helped a lot by Donald Simpson and Derek Fruin, who was the dean here, and Barry Vernon Roberts, who's Professor of Pathology, and they helped me to apply for and get a Nuffield Fellowship to Oxford, and that allowed me to do a PhD in Oxford. And then I did a year of spinal surgery with an orthopaedic spinal surgeon, and that would have been impossible for me to do in Australia, because at that time, if you did spinal surgery, it was either neurosurgical spinal surgery or orthopaedic spinal surgery. Nowadays, anyone doing spinal surgery gets training in both areas, but that was something novel at the time.
And what was your PhD on?
So it was some brain tumours, so molecular biology and gliomas.
And when did you come back to Adelaide?
I came back at the end of 1990.
And so you mentioned quite a few specialty areas, but did you have a particular subspecialty or area of interest?
So my main area of interest was spine surgery. I did spine fellowship in Oxford, and then I joined the spinal unit here as well. So I always was interested in spinal surgery.
And where did you operate within Adelaide?
At the Royal Adelaide Hospital, and then in private at Memorial and Wakefield.
What's the most hours you've ever worked in 1 week?
I don't know exactly, but more than 100.
What's the longest you ever went without sleep?
Too long. I can remember working one Easter from Friday morning until Monday night with just a couple of hours on a barouche.
What was your first surgery on a real patient?
It's hard to know exactly, because you gradually do little bits of things until you finally do something, but it's probably an appendix in general surgery.
What was the longest surgery you ever performed?
Probably 20 hours.
And what's the most surgeries you ever performed in one day?
I don't know, most of our operations take a fair while, so it's not a huge number. It would be 8 or 10 probably.
What was your most common surgery?
That would probably be a lumbar spine decompression. So it's a very straightforward operation, but with good results, helps people a lot.
And what's the most complex surgery you ever performed?
Probably spinal cord tumours within the spinal cord themselves. Some tumours at the junction of the brain and the spinal cord are pretty complex.
And can you give us an example of a day in your life as a neurosurgeon?
It sort of changed at different stages in my career. At the Royal Adelaide, I was doing a lot of research and teaching, so that would take up a large part of my day. It would also be on call, so you'd have emergencies that would interfere with other things, and then seeing patients and doing operating. In private, it was mostly seeing patients and operating. You spend a lot more time actually consulting and seeing patients, explaining things to them than you do actually operating.
What is one of your fondest memories of your neurosurgical career?
I've enjoyed all of it. It's not been like work. It's been learning all along, and I guess probably seeing my first PhD student, Marcus Studley, become Professor of Neurosurgery at Macquarie, and then Adam Wells, who I've known since he was a medical student, get appointed to an academic post here, supported by the NRF. That probably the highlights to see that.
And what were some of the biggest challenges?
The biggest challenges relating to the work at the Royal Adelaide and the university were funding and staffing, trying to find other people that were interested in doing neurosurgical research. And because when I started, there was no academic neurosurgical department in the country, and that's improved enormously. The NRF have been integral in funding that.
And you were the first chair of neurosurgical research for the NRF. Can you tell us a bit about that?
Well, I came back from Oxford having done a PhD and wanting to do research. I was trained in brain tumour research, but there wasn't really the infrastructure here to do that. There was no academic department to go to. I got an academic appointment in the Department of Pathology, so Professor Bernard Roberts organised that for me so that I could be part of the university. And then the following year, the NRF endowed the Michelle Chair of Neurosurgery, and I was fortunate to get that. So I was able to start doing research and teaching here in Adelaide.
How did you find splitting your time between operating, research and teaching?
It was really more doubling your time rather than splitting it, because you still have to do the same amount of clinical work, you still had to do on call, then there's the teaching plus the research. It all adds on rather than splits up. So it wasn't easy, and that was one of the difficulties of trying to fit into any established research group, because they were not used to having people with other commitments that you couldn't just lay aside. I remember discussing with someone joining their brain tumour group, and I was told, well, as long as you can be here 3 days a week without a pager or a telephone, because you've got to commit 100%, and you just can't do that. If you've got patients, you've got to be available.
Did you have any time for hobbies or anything outside of?
Yeah, it was very hard during that time in the early years, but then later on it became more important. I think these days people have a much better work-life balance, and the hours that we worked are not done now, and people can have a much more open family life, external hobbies more easily. Yeah.
What would you say is the value of the Neurosurgical Research Foundation?
Well, the NRF is based in South Australia but has a national outlook. It funds specifically neurosurgical research. A lot of people don't appreciate the difference between neurology and neurosurgery, and there's a lot of publicity goes to some specific neurological problems, and people don't realise that neurosurgical things are different. The NRF helps to educate in that. The people running the NRF have always been very passionate and have done it on a shoestring. So people giving money to the NRF know that their money is going to go to research, to teaching, to academic appointments in neurosurgery, and not be swallowed up by external costs. The funding of the chair here in neurosurgery and then the ongoing support for other academic posts is something that's completely changed the practice of neurosurgery here in South Australia, I think.
And how do you think neurosurgery has evolved over the years, and what do you see as some of the biggest changes?
I guess in my lifetime the biggest changes have been in imaging. To have CT and MRI makes just such a difference to what you can do, and added to that, you can use the imaging in the operating theatre now for navigation, so that you can use techniques to be able to see on a screen where you are in the brain or in the spine, which makes things so much safer. And that's probably the biggest change I've seen. The biggest negative change, I guess, is health costs, health economics, just in general. The health system is under a lot of stress, and that affects everyone. When I first started medicine, everybody in a public hospital did teaching, did some research. A lot of research was done as part of the day-to-day running of the public hospital, but that doesn't happen anymore. The public hospitals have to be financially aware and independent. If you want to try and do research, you've got to find external funding for all of it. So it's made it more difficult, and that makes things like funding from the NRF so much more important.
Are there any aspects of neurosurgery that you wish there was more awareness around?
That's an interesting question. I think the importance of things other than operations. So neurosurgeons don't spend all of their time operating. They don't even spend the majority of their time operating. Of the patients that we see, the majority of patients, we tell them that they don't need an operation, or we talk them out of an operation. Just because an operation can be done doesn't mean that it's always the right thing to do. And so, sometimes more conservative treatments are the best option, and not everything is fixable.
What advice would you give a student interested in pursuing neurosurgery?
I tell them it's a fairly long road, but it's definitely worthwhile if you're interested in those sort of areas. It's an excellent career choice. It's interesting. It's technically challenging, but extremely rewarding. I think it's important to get basics in anatomy, pathology, so that you can then build on that later. It's important to involve yourself in neurosurgical research, neurosurgical teaching early on, so that you can make a decision about what you want to do and where you want to do it. Be seen, get into the program. It's hard work. It's harder work than when I started. and a lot more is required of you. But if you really want to do it, then it's worthwhile.
So what would you say was your teaching style when you taught and mentored neurosurgery students?
I think I tried to treat people as equals and engender an interest in what you're doing. I find that making a diagnosis is very much like solving a puzzle. That makes it interesting. I think that it's important to see this not as work, but as a challenge that is interesting to you. Because if you're not interested, it's a very hard career to take on.
How long were you a practicing neurosurgeon for?
I started training in 1982, finished in 1987, and then practiced until I stopped operating 5 years ago, but still consulted until just 6 months ago.
And so how do you spend your spare time these days? Have you got any hobbies or passions that you finally got time for?
I've got lots of hobbies. I enjoy food and wine. I like travelling, which has been difficult the last few years, but hopefully now we can get back to it. I like France. I've been studying French language for many years, and I still do that. I like cycling, and probably my main thing is my family, and I've now got a grandson, and I've got the time to spend with him and my children. He's 7 months. Yeah.
Do you have a quirky or interesting fact about the brain or neurosurgery?
Probably the fact that although a lot of the conditions that we see are related to pain, and you sense the pain in the brain itself is not sensitive to pain. So you can do an operation on someone who's awake, and once you've cut through the skin and the bone, they don't feel any pain anymore.
So do they receive a local anaesthetic for that type of operation to do the...
Yeah, you can do that under local anaesthetic, and then you don't need any anaesthetic on the brain itself because it's not pain sensitive.